Everyone, I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is with us tonight to talk about how to avoid heart attack and stroke altogether, and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls, so make a note of this number. It's 800-859-0957. We'll repeat it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR. So what do you want to say about Costa Rica? You're looking good, by the way.
Thank you. We're gonna.
What are you starting off with? Then?
Well, I think. Well, we're gonna talk on air about the beginnings of a project that I've been working on for a couple of years. I've had some help, but we're gonna begin talking about it. We've alluded to it several times on the show, but we'll talk. We'll say as much as I feel like I can say about it.
We're still talking Central America.
I think we can say where it is because we have it. It was just protecting our access. But now that we have it, I think we can be a little more specific.
I don't want it to be obtuse. I don't want it to be like.
No, well, you can say tell us what was going on in Costa Rica.
Right.
So I think you can do that, and then
okay, that's fine.
But. We didn't prepare a whole lot else, so you've got to strong.
Well, I mean, it's you're the one with the information.
Yeah. So we'll start talking about it. Yeah, we're
on Facebook.
We know
we're good to go.
We're talking.
How come there's no
Facebook
pictures
people
on the wall? Videos.
Well, we're okay. We have another 30 seconds before we're done. We'll go to the show. So anyway, this is a pretty landmark event, that we're going to talk about in the show. And so excited and relieved and also a little nervous that all the things I worked for are happening. Now I have to do something with it.
You just have to be confident and say
we are.
Yeah. Someone else figured out they should jump on it before someone else did. They're lucky they know you. Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we are here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get all the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, I have to say I'm happy to see you tonight. Welcome back. You've been gone in Costa Rica. What were you doing there?
Well, thanks, AnnMarie. It's a pleasure to be back and on the air locally. So I'd say we had a triumphant visit to Costa Rica. It's something we've been working on. I've got some help for this. Let's go back in time a little.
And over a year you've been working on this project.
Probably a year and a half or 2 years. Yeah. But I was going to go back in time, like the beginning of the radio show.
Right.
So, doing the radio show caused me to have to think about things differently. Not just what to say on the show, talk about the practice, but it gave me a lot of urgency to think about healthcare in different ways. And I've gotten a lot of ideas of, for instance, I wrote a book that will come out sometime either at the end of this year or early next year. And so the idea for the book came out while I was talking on the radio. Somebody asked a question and I answered it, and I realized that's a book topic, and I made a note to myself, and it took me a year to start writing, but I got an idea for a book. So one of the things that we were, AnnMarie and I have always been talking about is how do we take the most advantage of this show? And, an idea that came to me is to create a business that can provide preventive services to more people.
That's the key. I'm just going to jump in here. I mean, I think you are in a very rare specialty because you're in the business of stopping disease before it starts. We know that heart attack and stroke can be prevented. We know that diabetes, and if somebody is on the pathway to developing cardiac disease, you've said yourself, if they get the right testing, it can be reversed, plaque can be reversed. So then we started thinking about, well, it's fine that we're broadcasting in Detroit, but I think one of the momentous things that hit us when we first started doing this show and talking about prevention, we went live. We thought everybody from Detroit would be calling, but we're getting calls from all over America. And then you realize how widespread this lack of information is.
Well, yeah, so we wanted to figure out some way to take advantage of this forum. And I thought one of the ways was to find a way to get healthcare to more people. These preventive services that we've talked about ad nauseum are just unavailable. So I started a company designed to deliver these services to more people at low cost. And again, through the show, somebody joined my practice. I'm not mentioning her name because I didn't ask her permission to talk about her on the air, but somebody joined my practice from listening to the show. And during one of her visits, I'm talking about whatever it is I'm talking about. And she does business in Costa Rica. And here we are a year and a half later. Again, a lot of hard work, a lot of preparation, a lot of planning. And meaning our company, has been awarded a pilot study. And we're working with the private medical schools and the private hospital systems in Costa Rica. And we're going to do the world's first prospective heart attack and stroke prevention study. And what that means is prospective means we're moving forward. We're taking people on day one and we're going to follow them over time, as opposed to reviewing data that's a retrospective study looking backward.
Mm-hmm.
So, I mean, this is a pretty landmark opportunity. Again, we created the opportunity. We created the business, created the whole concept, a way that could be delivered. And my partner saw an opportunity and we created that opportunity in Costa Rica. And so when the study actually begins, we're not sure, but very excited to put this whole thing together. Again, we worked really hard to make it happen. And it's a new adventure begins.
How do you think that's going to impact healthcare here? Because obviously, when you first moved into, you're a specialist in internal medicine, and then you saw there was a great need for having a concierge practice where you could spend more time with patients, and also specializing in prevention because you knew all these major diseases could be halted, prevented, reversed. The numbers have continued to go up every year. 700,000 men dropped dead of a heart attack a couple of years ago. Now we're up to nearly 900,000. Maybe it's even more than that. So there's no stopping the widowmaker. It still marches on. And this is like Heart Month. So here we are talking about it again. Things have not gotten any better. And as we say in every show, the tests are not covered by insurance. Nobody knows about them. They don't get them. Most doctors don't prescribe them. What you did in Costa Rica is fantastic, but how is that going to impact and help the Americans here in America?
Well, we're not going to have that much time to answer that
come
question.
Back, we can answer
yeah,
it,
we
though.
can
Got
answer
the rest
that.
Of the show.
But the wheels of science move slowly, and I think that it would take forever for the scientific community to recognize this on the path that's happening. So this is kind of a wake up moment. There's no question the science will show that this happens. We just have to do the study.
Just follow on with it. All right, well, let's talk some more about this on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here tonight with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk directly to the doctor about what you need to do to prevent or reverse disease, Don't hesitate to call 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR. Are we on Facebook?
We're back on Facebook.
But you're kind of sounding raspy, I gotta say.
I know.
What happened to your voice?
Yeah. I kind of burned my tongue eating something, so I'm a little
Okay.
hoarse. That's all. So it'll get better tomorrow. Probably a little. Shouldn't have done it, knowing that I'm on the air.
Right, but that's okay.
But yeah, so I'm not sick. Yeah, I just did something in my throat. So yeah, no, this is a remarkable opportunity. And again, we worked our tail off to make this opportunity. We weren't invited to do this.
But go ahead, but how's it going to affect here? Once you do these studies in Costa Rica builds in the prevention program there. How does that affect the American public?
I mean, well, let's talk about that on the air. But you know, we're really doing it there for another reason. We're doing it there to show that it can be incorporated within a socialized medical environment. Here, it's different, and to be honest, I don't know that it will. You know, but
you can't say that. You've always got to move forward, saying we're going to make it happen.
No, but we are, but not that way, and we're not ready to talk about that.
Right.
So you know, we'll have a different approach here in the States, and we're not. And when we're ready to announce what that is, we'll do it. But you know, we're hoping that we can find some, you know, brave people here in the U.S. to give us a jump start. But we'll, yeah. So that study is going to not start for 6 to 12 months. Then it's going to run for 3 to 5 years. So
that's a long time.
It's not like it's going to be, you're going to have answers tomorrow. So, and we got to review this on the air, but that all takes time. And so it all will happen. It will all happen, but we're going to start with a caller.
You have a caller?
Oh.
Sam.
Oh, okay. So if we have a caller, we can start with a caller. Yeah. So the United States is going to require a different approach.
Okay. What spots?
We got to end faster. Okay.
Okay.
All right, so we'll start on time and end on time.
And then we're going to come back to Costa Rica. I don't think we need to talk about it being a long time because that sounds too far off in the future. Welcome back to our special live weekly medical show on 760 WJR. We're back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many other chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we're now able to arrest and reverse the progress of these silent killers. We're inviting you to call in with any of your questions at 800-859-0957. Dr. Kolender, you've been telling us about your trip to Costa Rica, the study that you enhanced and brought over to them, and where do we go from here with them? Where are they going with this?
Well, it takes, it's going to take 6 to 12 months to get the study started. And even then, the study is going to have to run for 3 to 5 years to show outcomes. I don't have any concern about the outcome not coming, going the way it should, because we see it literally in every single patient in our office. So, we're going to be doing it. We have a caller?
Yeah, we have a caller. We have David from Windsor. David, what is your question?
Well, thanks for calling, David. And we hear about that all the time. We even hear about people passing a stress test and dropping dead of a heart attack after passing a stress test. And so that's just those are examples of how our current healthcare system fails to identify people at risk. And, in our practice, what we've learned is that when you identify people the proper way, you're not just identifying whether or not they have the disease that you're treating, you're able to identify their risk and assess it and decide how intense the treatment that you need to put them on to kind of pull them off the edge. So all of the people out there listening, apparently in Canada also, you're all under a preventive program that doesn't work. It uses a atherosclerotic risk assessment calculator that only is designed for people for over 40. And as we've talked about on the air many times, there are a lot of people in their 30s who have serious disease and are at risk. And then that calculator is based heavily on LDL cholesterol, the sex of the person, their age, and those things don't matter anymore so much because heart attack and stroke is occurring at earlier stages. So the system it fails to identify people early. It's really built to identify people who need a surgery, who need
that's somebody that's already been identified as having the disease. So that's too late. If you need surgery, you've already got something broken down.
But that's what the system considers prevention.
What prevention of what?
Well, if you have a surgery, you will prevent that person from having a vascular event because you operated on them.
What are you talking about? You talking about like doing
Like
a stent or a bypass or something like that?
Correct. I mean, that's
but you haven't reversed or stopped the disease. We're talking about something different.
I agree with you.
You prevent the disease from happening to where you need to get the bypass or the stent.
But
and that's what America needs to wake up to.
Right. What David's talking about is how the status quo is. And the status quo is sacrificing people who could be saved because they're not getting early prevention to identify people that need an expensive procedure or a pharmaceutical drug. And that's what's all wrong. So now we're going to be applying these processes in a research study, with a university hospital in a prospective manner, which has just never happened.
Well, I think what you're doing is incredible. I just hope that somehow this all pans out to the whole vast population in the United States that obviously are being disastrously underserved when it comes to the whole, preventative platform in medicine, because what you're doing is stopping the disease or identifying the disease way in the early stages. You're not at the point of most of the primary care physicians and cardiologists that are saying, oh, you got a blockage, now you need a stent, because that becomes a hospital admission. It becomes money. It becomes time off work. It becomes catastrophic. There's no other way of looking at it.
Well, plus that person has some comorbidity. They have other problems that have been ignored. That person might be diabetic. They may have had long-standing high blood pressure.
And how do you, let me stop you there. What do you mean ignored? Ignored by whom? By their doctor?
By the doctors, because they're not recognizing the disease early. So
why are they not recognizing it early?
They're not getting paid to do that. They're just not. It's so to say, what are we going to do here? How are we going to fix things in the United States? So this was step one for our company, that we started to provide these services. And step 2 or 3 is to try to move this here. And so we have a plan that we're not ready to, divulge, but hopefully soon enough we can have some type of answer for people in our area, or in some area in the United States. We'll be able to begin providing these out there. So we have an idea of what we want to do and how to do it, just not ready to tell you what that is yet.
Well, we do actually have advice right now that is germane, and it's to today, that everybody listening to this show and everybody anywhere needs to make sure that they vetted their doctor so that their doctor is aware of the necessary tests to prevent heart attack and stroke. All of those tests are available. You use them. You avail yourself of them. you're maybe a population of a few in the country, but I think that everybody needs to go to their doctor and say, are you offering the test, like the CIMT and the other tests that you provide to find out about disease and
And you
not
did your
wait?
CIMT today.
I did. That was
You-
the second time. I had it done before. I'm repeating it. I'm
Yeah.
following your advice. I'm not
Okay,
letting things slide.
congratulations. So,
No, and so is my daughter and everyone else I know. And the next thing is get in and get the blood test that detects all the 50 cancers. But I mean, I think that if you have a primary care physician and or a cardiologist, it's incumbent on them to let you know that the screening is out there. It's not acceptable to have the widowmaker numbers continue to climb into the hundreds of thousands.
so what's horrible here is that I'm going to tell you a couple bad stories. I mean, it worked out okay because they're my patients, but
Right.
they're overall, how did this happen? So I have two patients that I've had for, my entire practice, to over 20 years. And they're both women, I'm going to say 75 to 85 in that age range. And one of them has had an irregular heartbeat the entire time she's been with me. And so once we started going into the preventive aspects here, I've been trying to get her to do a sleep study. Meanwhile, she has a cardiologist who, has been treating her irregular heartbeat more than I have this for the whole time I've had it for 20 years.
Mm-hmm.
We finally diagnosed her with sleep apnea.
Mm.
And all I can think of, and mainly because she was also resistant to listening to me. So she finally listened to me. She did a study last year that was abnormal. She didn't want to believe it. She
A
repeated
sleep study,
it.
you mean that she had done? Was it a sleep study?
A sleep study. It
It
was,
was abnormal. Mhm.
and she didn't want to believe it. And then we did a second home sleep study that was same exact result pretty much. And now she agrees to go and treat it. But all I can think of is here's a cardiologist who treats irregular heartbeats, who knows that sleep apnea can affect these things, yet doesn't also reinforce that this person needs a sleep study because it's part of the underlying cause of the arrhythmia. And you have to ask why. And I hate to say this, but if treating the sleep apnea is going to make the problem you're treating go away and you basically lose a patient, you aren't really, you aren't being incentivized to treat the underlying problem. It's terrible.
Right. And we need to talk some more about who needs to get the sleep apnea test because it sounds like everyone. Anyway, right now we've got to take a quick break. You are listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. You're listening to 760 WJR. And we are going into
Well,
good job. Well, okay, I'm trying to keep up. If
So-
you get another call, just make sure you tap me so that I see that you've got a call.
Okay.
So,
because he might be talking. Go
yeah.
ahead, back on Facebook.
well, anyway, yeah, back on Facebook. And so we're very proud. Again, I'm going to keep reiterating this. We're really proud to have not just, created and gone after to have this opportunity. I mean, we
Mhm.
really took something, created out of the thin air.
Mhm.
And 2 years later, we're doing a research study, which is, now going to be probably global,
Mhm.
research opportunity to identify and prove that early intervention prevents cardiovascular negative outcomes.
Mhm.
And so how is that going to impact the United States? Well, again, I'd rather talk about this on air, but I don't, things change here in the United States so slowly, and they're so impacted by pharma and, the system that I don't really expect it to be taken in. I don't think like one study's everyone's gonna go, oh my God, let's switch.
Mhm.
We're just gonna have to take it over. Like, I mean, we're gonna have a different approach. I don't think that the scientific community, everyone makes too much money on all of you being sick.
Right.
So we can go over this on the air, but
That's kind of what's pathetic about this, though. What's pathetic about it is that people don't realize that It really is all about the money. You know, it's just all about the money. The country makes money. Everybody makes money when you get sick, when you need you're talking about getting diagnosed for a stent or getting diagnosed for needing a bypass. That's not really getting diagnosed. That's being told you're already on the road.
The whole concept of wellness is just a bunch of garbage. The whole concept corporate wellness is garbage, utter garbage. Let's talk about that.
Corporate wellness.
It's just garbage.
Mm-hmm.
And, and how hypocritical these companies are. They just want to say that they're doing something and they're doing nothing.
Mm-hmm.
So
what is it they're telling their workers that they're doing?
Well, we're here for your health. Yeah. And if you do these things, you get $50. And their insurance company will cut their premium down a little bit if they're doing some type of wellness benefit for their employees.
Mm-hmm.
But the wellness benefit that they're doing is the garbage within the system.
Mm-hmm.
Yeah. We have a caller. We can start with the caller.
Who is it?
It's Scott from Dearborn. Someone from
Okay, well, do you want to start with it?
Sure.
So I'll ask you as soon as I'm done with my coming back, and then I'll ask you.
Mhm.
Are you talking to me?
Got it.
We're section
Oh, we're
4.
getting Facebook now questions. Okay.
Do you want me to find it for you?
Yeah. Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention here with us tonight to give us some straight talk about two important topics, prevention and being proactive. Please tune into our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions at 800-859-0957. Dr. Kolender, we're going to take, Katrina has a call. Who is calling?
Yes, it's Scott from Dearborn. Scott, what question do you have?
Yeah, hi, doctors. I've called in before about the echocardiogram test. I believe you guys asked me to have because my brother had pre-existing conditions. What's the CMIT test? What's that all about?
Well, the CIMT is your carotid intima media thickness test, and that is a ultrasound of your carotid artery, which is in your neck. And excuse me, we take measurements of the layers of your artery wall, and one of those layers is where plaque buildup occurs. And there's a lot of data that suggests or tells us that the thicker that layer, the greater your risk is of having a cardiovascular event. And so what we do in my practice is we use that as a data point to measure our progress. And if we see plaque, we risk stratify the patients, not based on their LDL cholesterol levels or this formula that doesn't work, but on inflammation markers that measure the inflammatory process of making plaque and that intima media layer that we measure in the CIMT. So to me, that's a really important test to do. And we check it several times during, the course of the patient's time in the practice. So if someone has plaque and we're working hard on them, I make sure that we check that measurement once a year. Other people, I might check it every couple of years. It just depends on, what type of activity and, we're working on that particular person. But to me, that is the most important test because it gives us the information that identifies risk the best.
It's amazing how many people, even of the listeners that we have, and how many people out there aren't familiar with the CIMT and about how profoundly simple it is. It's easy, it's quick, it's fast, it's 10 minutes, it's non-invasive. The big problem is the doctors are not recommending it. I don't think cardiologists are even recommending it.
Well, no, because they're not trained to prevent disease. They're trained to identify disease that needs an operation. So, excuse me, the whole system is designed to identify end-stage disease. And what we do is wherever you are when you walk in the door, that's when we start treating you. We don't wait for anything. If you have disease, then that's hopefully the worst place you'll ever be. We'll pull you back. If you don't have a disease, well, then we have an opportunity to make sure that you never have plaque. We don't say, see you later. We still identify all the drivers of disease that can cause chronic illness and address them. So I might not check your CIMT for 3 years. I might not do another calcium score for 5 years, but we're still checking the blood work once or twice a year to measure our progress on all of the conditions that can impact multiple chronic diseases.
Well, obviously, you do all the preventative tests. I mean, everybody should be going to a doctor that specializes in prevention. And there are not a lot of doctors that are specializing in prevention. I mean, is it easy enough to find a doctor that offers all of these screening tests and specializes in prevention? Because you obviously can't see the whole country.
There's unfortunately not that many even in Metro Detroit. There really aren't. So we have people in our office, it's not just me. I've got colleagues and doctors that I've trained. So there's room in our practice for people to come in and, and have go through this process and have a great idea where you are and what you've got to do. So it's important to just have a baseline and know where you stand, because when you go to your doctor now and you get a clean bill of health, I hate to say it, that means nothing at all.
Well, it doesn't necessarily mean you have a clean bill of health, because as you said, you can still be walking around with cardiac disease. They may be able to diagnose diabetes from taking a blood test that measures sugar, but they're not able to look at the arteries of the heart in the way that you can do it with your testing.
We have some Facebook questions.
Yeah, well, go ahead.
So Greg, Mr. Positive, texted in.
Oh, good.
He wants to know, hello, Greg. Sorry, you're not calling in either. So Greg's asking, does heart disease affect Alzheimer's disease or Parkinson's? Is there a possible relationship? So, there is a relationship in that a lot of the drivers of inflammation that cause heart disease also cause Parkinson's and Alzheimer's, specifically, what I call the silent killers, insulin resistance, sleep apnea, and periodontal disease, which is bad oral health. All of those 3 things can cause heart disease in one person, Parkinson's in another, and Alzheimer's in a third person. And we really don't have a great way to measure those other 2 diseases. So that's why it's important to recognize the people that have insulin resistance and periodontal disease and sleep apnea and address them even if they don't have plaque. And that happens in the practice. We have people who have no plaque, but they have those other 3 conditions. And we work on them aggressively, because I don't want my patients developing Alzheimer's or Parkinson's either.
Right.
We just don't have a great way to measure chance of having Alzheimer's or chance of having Parkinson's.
Well, also, I think that a lot of these diseases, I mean, certainly Alzheimer's and certainly the precursors to cardiac disease, are caught in the oral cavity screening.
All of these things are just not known.
Right.
They're just not known.
Hardly any of it's known. That's the problem. Nobody tells you about it.
And so, when it comes to, just go back to sleep apnea for a second. So we're talking about this one patient who's had an arrhythmia for 25 years. And here I am telling the person to get a sleep test and not the cardiologist. And again, I don't want to say every cardiologist is not doing sleep studies on their arrhythmia patients, because they'll make more money if they don't fix the sleep apnea, but you got to wonder. The reality is, if you're listening to this show and you have a cardiac diagnosis, you should probably get a sleep study, because sleep apnea impacts the disease that you have. And so what if you do a sleep study and you don't have it? Well, now you know that you don't have it. And a lot of people have negative feelings about treating sleep apnea, but don't let that get in the way of your health, because go first, identify the disease, and then you've got a question to ask or a problem. Should I
Right.
treat this or not? But don't not get the diagnosis because you've already decided what you will or won't do. Well, that's not a fair question. You've got to go and do it.
And also, I know in your office, and that's one of the benefits of your practice, is the sleep apnea test is now a home test that you take home. You don't have to go and spend the night in a clinic and being hooked up to all kinds of different wires and machines. You can actually take the test and do it at home.
I have another quick anecdote before the segment ends. So the other lady, the 80-ish-year-old lady who I've had in the practice forever. So a couple of years ago, 3 years ago, she's in the hospital because she lives in a assisted living and stood up and almost passed out. So she goes and gets a whole workup at the hospital. Of course, they sent her home with no diagnosis. And then I see her and I said, this is sleep apnea. So
Wow.
I do the study, and of course she doesn't want to do it, but she does it. And I saw her just before I went to Costa Rica, and she had heart failure. She had high blood pressure. It's all gone. We
my
were able
gosh.
to cut out 95% of her blood pressure pills.
Most important test, a very simple and easy test that can be taken home, done at home. One of your easiest tests, non-invasive. I think that everybody should actually have this test. In the meantime, we're going to have to take a quick break. You are listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subjects we're discussing and you would like to talk directly to the doctor, don't hesitate to call 800-859-0957. Again, that number is 800-859-0957. You're listening to 760 WJR.
We have one more Facebook question. It's not really a question, more
Yeah.
of a comment.
Who's it from?
Kelly. I'm not going to give last names, but Kelly. So
From here, Detroit.
yeah. Well, asking, why Costa Rica? We're screwed up here in the United States.
That's what I asked.
Well, that's the opportunity we got. So
That's right.
you got to take you got to make your opportunities. There's no way this study would happen here. No way. Let's answer the question, because it says a lot about Costa Rica that they're doing the study. Well, we're on the air, AnnMarie.
I
It's
know.
Facebook. So
No,
this
I
is
understand.
the thing that you wanted. So
The thing that I wanted,
yeah,
what?
the Facebook to be on. You
Right.
have to entertain these
We
people.
have to, well, we're going to entertain them, but
So
you're the entertainment.
yeah. So we'll talk on the air about why Facebook, but sorry, why Facebook? That's my question. Why Facebook? But we'll talk on the air about why Costa Rica and how why it's special that they agreed to do this. So it's not just about, why did I pick that place? I'll say the place, picked me. Like, it just happened that way.
Well, yeah, but that is true. Somehow,
Yeah.
inadvertently, they found you.
Well, it's not just a who found who, but it's, the forces that be, put us in that position. No one's looking to do a study that doesn't make anybody any money.
Mm-hmm.
That's a reality. No hospital or pharma or anybody is looking to do a research study on a process that makes no one money, but they are, because they're vetted, they're interested.
Mm-hmm.
They're invested in the health of their people.
Mm-hmm.
They have a national health service.
Mm-hmm.
And that means their country's paying for their people's health care. And if we can show that a small amount up front is going to save a lot of money on the back end, then it's worth it.
Same thing with the UK. Their national health care, same thing.
Well, let's go do it there and call your people.
No, you're absolutely right. Because, they obviously jumped on the blood test to detect the cancer. They jumped on taking that
the
study.
company's probably paying for that study, so
Well, it still would make sense, though. It makes
Yeah,
sense that they would want
it
it
makes perfect sense.
because they don't want to wind up with all these people going into the hospital and being on their back financially for the rest of their
Well,
lives.
any country that is invested in the cost of healthcare would be interested. Every country except this country,
Right.
because they're invested in your illness.
Mm-hmm. Yeah.
So let's go to the. Do we have any calls, Katrina? No. So let's go. We'll come to this one. And maybe one other study, just the why Costa Rica.
You're done talking
question.
about the sleep apnea, the lady?
Yeah.
Okay. Okay.
I have one other
Okay.
kind of anecdote about stress.
Okay. So what am I starting off with?
Question?
We have a caller.
I do the
Who is
caller
it?
first.
Who is it?
It's Aaron from Northwell.
Okay, I'll tell you in a minute.
Mhm.
I'll ask you.
Do that one then.
I'll do
this
it
one.
first. Okay.
So Kelly, we will come to you in a minute.
Great. Welcome back to the final segment of our special weekly live broadcast here on 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to ask us at 800-859-0957. We're going to come back to Katrina. You have a caller. Who's calling?
Yes, Aaron from Northwell. What is your question?
Yes, what are those 6 tests? I would like to list them out, if you could, doctor, the 6 tests we need for the treatment or prevention.
Sure. I mean, I'm going to go fast just because it's not great radio, but AnnMarie, you got to change that ad because
I know I'm definitely changing it. It's not necessarily. It's more complicated than 6 tests.
It's not really 6. So, so I'm going to give you what you need to know, which is you need to get a CT calcium score. You need to get an ApoB level, which is a total number of your bad lipid particles. You need to get a fasting insulin level, a triglyceride, and an HDL to get an idea about insulin resistance. You need a lipoprotein A, which is a genetic marker for heart disease. A uric acid is important. I've just added that today. I mean, I do it for everybody, but I'm just saying it now because treating elevated uric acids is important to lower risk for cardiovascular disease. And then, of course, your CIMT, if you're able to get into our office, that is the number one most important test.
And, and getting the CIMT, if you can't find it of the other doctors out there, call 866-Kolender. That's 866-KOLENDER. And you can either have it done in Dr. Colender's office or he'll refer you to somewhere. Thanks for calling, Katrina. We have another caller.
Yes, we do. We have Anne from Allen Park. Anne, what's your question?
Yes, I'd like to know. I do have a breathing machine for my asthma and my sleep apnea, and I do have cardiac issues, but I can't sleep when I have that on. I can't sleep. I just lay there for a couple hours,
Does she have the
and I
mask?
am tired, but I cannot sleep.
Well, follow up with your sleep apnea specialist to maybe have you refitted for a different mask so that it'll work better for you, but don't give up on it. There's other things about sleep you've got to work on, which is you've got to exercise every day. You've got to make sure that you go to bed hungry. You don't want to eat right before bed because that'll trigger acid reflux and wake you up. You want to make sure that the room is the right temperature, that you should wear a eye mask to keep away any extraneous light, which will negatively impact your sleep. So all of these things and more you need to do to optimize your sleep, but don't give up on treating your sleep apnea because it will have a serious issue. But also follow up with your sleep doctor to make sure the mask is the right one for you.
Thank you for calling. That is a good caller, and that's a good question because I know a lot of people give up on the the CPAP machine very quickly. You know, they get the test, they find out they have it, and I know that there's probably better than 30% of the people just say, I can't deal with lying on my back, I can't deal with the noise, I can't deal with, you know, having to have the sleep disturbance that bothers a lot of people. And sometimes they're not just going through one mask, they might be going through another and another.
Well, now they have that new device called the Inspire, which I don't have a patient who's used it yet, which is that implantable thing for sleep apnea. So I don't have any experience with it, but for people that are, you know, that qualify, that fit the criteria for that procedure, you know, it might be something to look into. So
And what is it that they do different with Inspire, just for the listening audience?
Well, it's like a pacemaker almost, and it's implanted and it wraps around your nerve in your neck, and you have you have an on-off button, and when you go to bed, you turn it on so that when you're triggering a breath, it increases muscle tone to your airway, and it's supposed to fix the sleep apnea. So the data on it was pretty good. I don't like the idea of having an implantable device, but that might be just a price to pay to manage sleep apnea in difficult people. And I don't mean difficult people, but people having a hard time
Adjusting to the mask and to the whole
Right.
process
So
of sleeping with the
I don't want to
mask.
say no yet, but again, it's a new product and I don't have a lot of experience.
So what doctors are advising, of the doctors that we see, our primary care physician? I mean, they're not all saying you should get a sleep apnea test, but it's sounding to me more like everybody should get one. It's
Well,
not that complicated of a test.
in my practice, where I'm trying to make sure nobody has a negative cardiac outcome of any kind, I have to screen for sleep apnea.
Right.
And I have the time, you know, like we say, it's a concierge practice. So I've got more time to spend with each patient to have these conversations.
Right.
Things I'm telling everybody in the air right now are, this is how I talk to my patients,
Mm-hmm.
you know, and sometimes you're doing this study, you're doing a sleep test.
Mm-hmm.
You're doing the oral DNA, meaning you're getting a genetic imprint of the bacteria in your mouth. We're going to do that too. So,
Mm-hmm.
these are things that I just, you know, my patients have all heard it now.
Mm-hmm.
So they know that I'm requiring them to do these things.
And I must say, having been in your office for some time this afternoon, it's a very peaceful place. And I think that people don't realize, when when I was looking around your office, there's no one in the waiting room. There's no one ever in the waiting room. And patients are coming in and they're seeing you or one of the other doctors, and they're getting a whole hour in there with you while you walk them through what they need to do, what they ought to be doing, how they need to change their lifestyle. I mean, it's a whole gulag. It's not just, call up and order a test or come in and get the CIMT and leave. That doesn't work. I think what's missing is that people they're not given the time or the opportunity to sit and listen to a doctor for a whole solid hour discussing every aspect of their health. And when you go to your office, if you have a 2:00 appointment, you're seeing it too. You're not in the waiting room. You're not losing time. People really ought to embrace this whole idea of a concierge practice, whether yours or someone else's, but it is a huge difference in the information the patient's getting and the feedback the patient's getting and the guidance.
Well, from the doctor's perspective, meaning mine, it's the only way to go. You
Right.
know, I mean, I cannot imagine going back and having to see 40 people in a day. And really, and knowing now what I know now, which is I'm not providing any kind of service at all. Before we go, we had one more person on Facebook,
yeah, go ahead.
if that's
Go ahead.
okay.
Yeah, go ahead.
So Kelly reached out to us on Facebook asking, you know, you'll get different results in your Costa Rica study than the US due to pharma's grip on the FDA and the CDC. Well, the reality is there's political issues going on in every country.
In every country, yes.
And there's some politics happening, and, you know, it's just the nature of the world. So even though Costa Rica has a phenomenal national healthcare system, it's not perfect. You know, they don't have the money they have in the United States, but their healthcare system is,
They're willing to try.
willing to try, and they recognize that they want to be proactive and on the cutting edge of healthcare in general.
Same thing with the UK, and I'm jumping in to give them a shout out because they embrace the blood test that detects the 50 worst cancers.
Well, when the government is financially involved, you know, and our government is, but they don't care. They just keep blowing money away. So yeah, there's FDA issues everywhere. There's pharma issues everywhere.
Here.
And here too. No, in Costa
Especially,
Rica,
well,
everywhere.
yeah, I know. Anyway, it looks like we're more or less out of time, unfortunately, this week. So I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening live at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.
Opinions heard in the preceding program are those of the host and guests and not those of Cumulus Media or WJR Radio.